The single most important thing that I think new parents need to remember is that taking care of yourself in the postpartum period really is not selfish, it's self-preservation. We are socialized to believe that if we take time for ourselves, if we take a break to take a walk, if we take a parent's night out, if we take a nap, that somehow takes time away from the baby. We've got to switch that thinking around. Taking care of a baby is very much like the oxygen mask on the plane. What do they say about that when you get on the plane? Put your own oxygen mask on first if you're traveling with small children, because if you pass out, you're not going to be able to help that child with their oxygen mask. That's very much true in the postpartum period as well. If you don't take care of yourself physically, emotionally, you are not going to be able to be the parent that you want to be. Getting past that hurdle with new parents is probably the single most important thing that they can do to both prevent postpartum depression and anxiety and to deal with it if it's occurring. I think another factor that is really important in helping parents get past that hurdle of taking time for themselves is to understand what we're teaching our children by doing so. When children have a chance to be cared for by other caregivers besides their parents, they learn to trust other people in the world. They learn their parents come back. They learn that the world is actually a safe place and that there may be many adults upon whom they can rely. When we set a baby down in a carrier with a toy or on a blanket and let them fend for themselves for a few moments, they learn resilience, they learn self-sufficiency. If you play with your child all of the time, from when they're born until when they go to some form of organized care, whether it's when they're 2 for preschool or kindergarten, they're going to expect one-on-one interaction with the adult in their world all the time if that's what you've taught them. Kindergarten teachers don't like those kids. They just don't. So for you to take care of yourself, and that gives the child time to learn to be self-sufficient, learn to amuse themselves, is a real gift you can give your child for getting along in the world as well. There are many effective ways to do psychotherapy or support group therapy in the postpartum period. In-person is certainly a good option. Online therapy has become readily available in our current age and can be just as effective in the postpartum period. There are also numerous support groups, both in-person and online, that you can find. If you don't want to talk with other people, but you would like to be able to tap into the experience of other parents, there are even Facebook special groups or online chat rooms where you can talk with other parents and see, or maybe not even talk with, but maybe just observe other parents and realize you are not the only one going through that. This sense of many of us are suffering in this way tends to help us feel like there's nothing the matter with me, and that can be very healing too. As we've said, 50% to 80% of new parents have some negative feelings. You don't have to wait until you are in a full-blown postpartum disorder of anxiety or depression or stress before you seek help. Support groups in particular can be really helpful with just the normal transition to parenthood. So seek those out if you're the sort of person that feels like you would benefit from that kind of support. You might wonder who you need to report to or share with about what you're experiencing. That is a completely individual decision. If you want to tell other people in the world about the difficult time you are having in the postpartum period, you will probably find a lot of support out there. When we are willing to speak up and be honest about what we're going through, other people follow that lead and speak up with honesty as well. You don't have to tell people if you feel better as a private person not confiding in others on this issue. That is a totally individual decision. Because of our myths and our unrealistic expectations, you might be able to go out into the world and look quite like you have it all together, even when you are suffering inside. I have found in my practice with postpartum parents that that is a very common thing. Because of those myths, we think we should act like this is the most wonderful time in our lives when we might really be suffering inside. So what others can observe is no indication of what's actually going through your own head. That's another important piece to remember when you are evaluating others. Somebody might look like he or she has it all together when really they are suffering inside as well. This can increase our empathy and compassion for other new parents. We're all having a hard time, even if we don't show it. We've talked about psychotherapy and medication as key pieces in the recovery process from perinatal mood and anxiety disorders. There are lots of other complementary and alternative pieces that could be part of a comprehensive treatment plan, such as meditation, acupuncture, massage, yoga, exercise in general. If you want to use substances in addition to prescribed medications, just consult with your provider so you can be sure that all of these pieces of your treatment plan work together in a complementary fashion rather than compete with each other or could make things worse. Many new parents want to know, when will I feel better? That is a completely individualized answer for every person. Medications, if you choose to take them, might work really quickly within 2 or 3 weeks. It might take more months to figure out what works for you. If you decide to forego medications and you want to build your treatment plan around complementary substances, exercise, etc., that might work for you within 2 weeks, and it might take much longer. So there isn't really any way to know when you will be feeling better. But an important part of that process is to find some way to document your improvements. You might want to keep a journal of good days and bad days so you can see that the good days are improving. You might want to come up with some sort of token jar so that every time a positive experience happens, such as your baby smiles at you, or you manage to calm a fussy baby, or you get through a day without crying, or you get through a night without worries, that you put something in the jar so you can see that progress building up over time. The brain has what we call a negativity bias. We tune into what's wrong rather than what's right. And so we need help like this to see the positive that might be right before us, but we can't discern.